Ever found yourself pondering the intricate workings of your body? Today, we're diving into the fascinating world of glucose regulation. Now, this might sound complex, but in essence, it's the process that keeps our bodies running smoothly by maintaining stable blood sugar levels. And it's vital, especially for organs like the brain, which heavily relies on glucose for energy. Imagine a fine-tuned machine. Our body works in a similar way, especially when it comes to regulating blood glucose levels. The normal fasting blood glucose level usually sits between 70 to 100 milligrams per deciliter. After meals, these levels might rise temporarily but are usually kept within a healthy range. So how does our body manage this? Enter the powerful hormones produced by our pancreas, insulin and glucagon. Insulin, released by the beta cells, is like a key that unlocks the cells, allowing them to take up glucose. This helps lower the blood glucose levels and promotes the storage of excess glucose in the liver and muscles as glycogen. On the other hand, glucagon, released by the alpha cells, acts as a lifesaver during fasting periods. It raises blood glucose levels by stimulating the breakdown of stored glycogen into glucose and promotes the production of glucose in the liver. After enjoying a meal, our body goes into postprandial glucose regulation mode. The carbohydrates from our food are broken down into glucose, causing an increase in blood glucose levels. Insulin then steps up to facilitate the uptake of glucose by cells, preventing excessive postprandial increases. Between meals, our body switches to fasting glucose regulation. The liver releases glucose into the bloodstream to maintain blood glucose levels. Here, insulin secretion decreases, and glucagon may be released to prevent hypoglycemia, which is low blood sugar. A healthy glucose regulation process is all about balance, especially between insulin and glucagon. In conditions like diabetes, this balance may be disrupted, leading to elevated blood glucose levels, also known as hyperglycemia. Insulin not only facilitates the entry of glucose into cells, but also aids in the storage of excess glucose as glycogen in the liver and muscles. This stored glycogen can later be broken down into glucose and released into the bloodstream when energy is needed. However, in conditions like insulin resistance and type 2 diabetes, the body's inability to use insulin effectively can result in hyperglycemia. Insulin resistance occurs when cells become less responsive to the effects of insulin, leading to elevated blood glucose levels. Maintaining proper glucose regulation is crucial for overall health. Disruption in this regulation can lead to health complications like diabetes. Managing such conditions often involves lifestyle changes, medications, and regular monitoring of blood glucose levels. If you suspect issues with your blood glucose levels or diabetes, remember, it's always wise to consult a healthcare professional for personalized guidance and treatment. And there we have it, the intricate process of glucose regulation unraveled, from the role of insulin and glucagon to the impact of lifestyle and health conditions. It's clear that this is a vital process keeping our bodies running smoothly. So the next time you're enjoying a meal or going about your daily activities, remember the fine-tuned machine that is your body, working tirelessly to maintain that perfect balance.